Okay, hello everyone. Thank you so much for joining us this evening. It is wonderful to have you with us. Unfortunately, sadly, in this virtual capacity, not in person, that we're able to kind of raise a toast together on what is appearing to be a nice sunny day here in the UK, at least. I see the discussions in the chat about various warm weathers. It's pretty warm for the UK right now, so we're not doing too badly. So as I mentioned, just a few kind of pieces of housekeeping, and then I will talk us through what to expect from this evening. So as I've mentioned already a few times, this will be recorded. So please feel free to keep your video off should you want to not appear in this. And we'll talk about how you can do questions and things whilst doing that in a minute. So we'll be kicking off, as I say, with the panel events, and we're talking to the panelists who'll give us an introduction about who they are, why they're here, and challenge them to give us their one top takeaway from the paper and this research area. After that, we're going to have some questions from myself to the panel. And following that will be your opportunity to ask your questions. You can do this in a number of ways, which I'll go through again when we get to that stage. But the easiest way, probably, if you're happy to speak out and unmute yourself, is to use the raise hand function you'll find at the bottom of your screens on Zoom. That will bring you to the front of the queue, means I can easily see you, and then I will say your name and ask you to unmute and ask your questions. If you want, please feel free to use the literal hand. It will just be a little bit harder for me to spot you. So if you can, do use the virtual one. Alternatively, if you prefer not to come off your mute or don't want to be on camera, then please just use the chat to drop in your questions. And one of my colleagues will be collecting them. And then I'll be looking and checking and trying to make sure those get asked as well as those putting their hands up. So as I said, we'll go through all of that again when the time comes, so don't need to remember all of that. But first off, I just wanted to give a little bit of an introduction to why we're here and a little bit more about MQ. So I'm hoping many of you know MQ, and that is why you're here today. But we are a global mental health research charity and have launched research all around the world to the tune of about £23 million over our last 10 years. And actually, you're here tonight helping us to celebrate as well our 10-year anniversary. So we fund everything from the very common anxiety and depression through to serious mental illness. And as I've mentioned, we fund globally just to find wherever that best research and that best science may be. We also are incredibly interdisciplinary. We want to find those different ways of working and often literally force these people in a room together to get them working and get them collaborating. And that's a real USP when it comes to MQ. So in terms of how we've got here and this paper, Gone Too Soon, it's a process that MQ has really built up over our 10-year history and something that we're really becoming known for in the sector. We do a lot of landscaping work to understand what's being funded in mental health research, or sadly, what often is not. We're able to point out where those gaps are in the landscape, so therefore we might have the greatest impact in our investments, but also to help shape the wider investments of the mental health research sector. We do this process time and time again in different areas where we see those greatest needs. And that might be from looking at young people's mental health back in our early days at MQ, through to particularly when the pandemic hit in 2020. And very quickly, we were able to do the process, which you'll hear more about tonight in this process, where we brought together academics, clinicians, policymakers, and really importantly, those with lived experience to understand when the pandemic hit, what needed to be those greatest areas of priorities for mental health research. That was then published in the Lancet Psychiatry and quickly became one of the most, if not the most cited papers in the Lancet Psychiatry that year and the following year. So we're really excited to have recreated that process in another really important area, but in a slightly different way as well, which I won't steal the thunder of our panelists today who can tell you all about it. So without further ado, I will firstly hand over to my colleague Brian, who's going to play a short video that if you haven't read the whole of the paper yet from cover to cover, this will hopefully give you a little bit of an insight into those top priority areas that we'll be discussing tonight.
Globally, people with serious mental illnesses pass away up to 10 years earlier than the general population. This is due to suicide and the comorbidities between physical and mental health. Too many people are gone too soon. So how do we reduce mental health-related early deaths? A group of 40 global experts and researchers have produced a roadmap backed by science for a future where these devastating losses can be prevented. They have made 18 recommendations, including early intervention, reducing discrimination, improving training and building capacity, improving health screening and early diagnosis, promoting healthy workplaces, tackling stigmas, and investing in research. All of these recommendations are actionable and can be implemented to help save lives. The time to act is now. MQ, because without research, it's just guesswork.
Brilliant. So that's your little teaser for this evening. And so I'm sure you've heard enough from me. Apologies, you will hear my voice lots as I'm asking many of the questions this evening. But actually what's more important is to hear from our wonderful panelists that we've got with us here today. So I'm going to ask them, as I mentioned, to each do a quick introduction to who they are. And as I say, try and pick just one of the recommendations that we have in the paper. So Rory, I think you're expecting me to hand over to you first, so hopefully not too much of a surprise, but over to you.
Thanks, Emily, and welcome everyone to good morning, good evening, or good afternoon, wherever you are. I think Costa Rica seems to have it so far. So what I want to do is just say a bit more about the process of the paper, and then what my sort of one of my key messages I took from it. So my name is Rory O'Connor, and along with Carl Worthman at Emory University, we were the co-leads of the Gone Too Soon project. So I'm Professor of Health Psychology at the University of Glasgow, and I've been studying research for many, many years now, I think about 28 years into understanding suicide and self-harm. And I'm also the president of the International Association for Suicide Prevention and a trustee of MQ. Now, when I got the email, because we were just thinking just before we went live there about when this process actually began. And the process which led to the paper published a couple of weeks ago began in probably the first email I got from MQ, somebody at MQ was, I think, in the middle of 2021. And when I was checking back on my emails, then the first email that Carol and I sent to invite people to become members of the group of people involved in the MQ Gone Too Soon project was sent in December 2021. So you can see it's about 18 months in sort of the gestation this paper has been. And huge thanks to the 40 people who took part as co-authors in this process, because what this process involved was, for the first time, I've never done a road mapping exercise before, and led by our amazing colleagues at IFM Engage, who are based in Cambridge. They led us through this road mapping process, which involved, first of all, once we'd agreed on the list of 40 people who'd be involved in the process, and we were guided by ensuring that we had global diversity, global representation, but also representation across policymakers, people with lived experience and living experience, grant-giving bodies, other researchers, clinicians, and sort of public policy, but across a whole range of academic disciplines as well. And we were delighted that we were able to get together, represent this individuals from 5 continents from across the globe. And then in terms of the process, we began then with some pre-work. And the pre-work, before we met, as you'll see in a second, we met as a group in 2 occasions, and then the sort of the writing in earnest began. But what was really crucial was when we were thinking about this whole idea about Gone Too Soon, we'd started off with this idea that, yes, as Emily has said, if we think of the 2 major causes of death associated with mental illness, we've got suicide on the one hand, and then on the other hand, we've got the comorbidities associated with mental illness and mental distress more generally. And so when we started out in our process of trying to make sense of what these solutions might be, what these key risk factors might be, we decided at the outset that we'd be agnostic about whether we would do one paper, which would try to combine the sort of solutions and risk factors associated with both of those mortalities, so suicide and comorbidities together, or whether they'd be separate papers. And I suppose, and that leads me on to, in a second, what my key message is, what I think is really important about the paper is that sense of that coming together, that synthesis which the paper gave rise to. But just a couple more words on the process, and then I'll just finish with, I think, my sort of key take-home message. So then so we asked people in advance then, we'd recruited people with expertise in either suicide or mental illness or the comorbidities of physical and mental illness. And then in the pre-work, we'd asked people then to basically answer us 3 questions associated with both of those, with mortality associated with suicide and mortality associated with comorbidities. And really those pre-work questions were asking, really trying to get some sense of what we thought the key risk factors were, and also what could be done. So trying to move away and generate a long list, I suppose, of risk factors and potential solutions. And then as a group online, we came together on 2 occasions for 2 different workshops. And in workshop 1, again, facilitated by our road mapping colleagues at IFM Engage, we workshops really trying to then make sense of the material which came in the free work, but also really to generate a list of these risk factors and mechanisms associated with premature mortality. And then in the second workshop, we really then focused in on the solutions, which were generated through discussions at workshops and pre-work, as well as being informed by the research literature, but trying across both of those workshops to agree a synthesis of key risk factors and mechanisms associated with mortality, and then linking those to what turns out to be 18 key solutions. So I suppose 2 key messages came to my mind, and then I'll finish. So the overarching one comes back to that point I made a few minutes ago, or a couple of minutes ago, which was at the start of this process, Carol and I, and the rest of our members of our 40 members of our panel, we didn't know whether we would aggregate into one single paper or 2 separate papers. But what became really apparent from the free work and then the first workshop onwards was that the degree of overlap in both the risk factors and mechanisms, as well as solutions, both for tackling suicide prevention, as well as tackling premature mortality associated with comorbidities, there was so much overlap that for us, there only was one decision, that what we wanted to do was do something different, which was to bring together, synthesize the evidence across both of those often 2 disparate and distinct domains of mental health, and bring them together, that idea of obviously the whole being greater than the sum of the parts. And indeed, I think that's one of the, huge successes of the project. It's been able to learn across from both disciplines. So me as a suicide prevention researcher, I've learned a lot about working with colleagues in the sort of comorbidities field, and how we can work in both directions, both in terms of us informing them and them informing us. And crucially, so hopefully by the end of the process, there's no them and us, but just all of us working together really to tackle these challenges. It doesn't matter which statistic we look at. I mean, the statistics are just horrifying about the premature mortality associated with mental illness and mental distress. I suppose that's my key message, and I'll end there, Emily.
Fantastic. Thank you so much, Rory. That's been a really helpful kind of introduction to help people understand the process of how we kind of got here today. So Paul, if it's all right, I will hand over to you to do your introduction and what your key takeaway is.
Thank you, Emily. Well, let me introduce myself first then. I'm Chief Executive of an organisation called the Wolfson Foundation. We're a research and education funder. Our funds come from an endowment set up by the Wolfson family in the 1950s. And Rory and I, before everyone joined, were talking about Glasgow, which is where the roots of the family are. But in fact, we're a UK-wide funder. And indeed, over the last few years, we've had something of an emphasis on funding research into mental health, including a major UK-wide research initiative in 2019, which led to the creation of the Wolfson Centre for Young People's Mental Health in Cardiff, based out of Cardiff. And we've also been very happy to partner with MQ over a long period of time. But not least, and most recently, for what I think has been a fascinating piece of research on long COVID and mental health. So that is the kind of, there's a 30-minute version of that, but that's the 2-minute version. But as the first speaker who had nothing to do with the report in terms of its writing and drafting, perhaps I could just say what a wonderful report I think it is, how impressive, and the clarity is something that I particularly appreciated. And I suppose my key takeaway was, from a funding perspective, was the headline takeaway, really, which is, I think, as anybody involved in grappling with the issues of mental health and distressing statistics, and the sense that there has been so little progress compared to infectious diseases, chronic diseases in terms of stats, can be tempted to despair, or even worse, take funding away from the area. And the key takeaway, to my mind, is that this is a tractable set of issues. Not straightforward, but with a roadmap for investment and a roadmap for real progress. So that was the key takeaway for me. And if I'm allowed a second point, one of the really interesting points to come out from it, maybe not a takeaway, but an impressive point, was the way in which those who have got personal lived experience were absolutely embedded within the research. There was no hierarchy of perspective. And I think that probably sets a standard, not just for mental health research, but for other forms of research as well.
Fantastic. Thank you so much, Paul. So Harry, if it's all right, I will hand over to you.
Yeah, absolutely. I mean, I thought it was favourable for me to go towards the end, but I've been shown up by the shirt from Rory and now two of my comments I can make from Paul, so that's excellent. But I also did not have a direct involvement in the same way as Rory did, but both Rory and MQ are people from a research background that I look up to and try to take it as much as I can. So I learn as much as being here as everyone else, hopefully. But why I'm here, I think there are 3 reasons. So one, I lost my father to suicide 16 years ago. So I've had a fair amount of time to, I guess, pause, reflect, look back at the life that he was living, the environment that he was in, the workplace that he was in, the friendship groups he was in, the access he had or the access he didn't have. And that's the biggest driver for why I'm here. I am someone who has had thoughts of suicide 6 years ago. I've never acted upon those thoughts, and it was a very short moment in time in my life. At that time in my life, I looked as if things were going incredibly well on paper, and my life was very well set. So from the outside world looking in, life was fantastic. But as I look back now and look at the report as well, I actually went through last week and just thought about my life and reflected back to 16 years prior to my father, and actually not a huge amount had advanced for me. And then finally, I lead a company called Corin Co, which is a mental health and suicide training company that goes into organizations across the globe and teaches people how to talk about suicide, how to spot the signs, and how to intervene. And for me, that is my way that I can give back, empowering people with the tools and knowledge and confidence to actually have those conversations. So I've had 9 hours today talking about suicide in central London. So for me, this is actually my relaxation now. But no, I'm having looked at the report and read through the report. I think for me, it gives me confidence from a personal perspective as to what I'm doing, from building, hopefully promoting healthy workplaces across the globe. But most importantly, I think it gives people different ways in. So different ways of accessing, but also that kind of background. Actually, this has been backed by research and professionals to say, well, if we're going to be active in this space and you want to use and mobilize all that energy and drive that you have, here are very credible, real ways that you can do that. So for me, lots of personal deep reflection, but also very practical points as it gives people ways in. But yeah, that's, maybe I'll pause for now.
Fantastic. Thank you. And thank you, Harry, for being here with us and sharing your own personal experience as well. We really appreciate that. Fantastic follow on from what Paul was saying about really making sure that lived experience is at the heart of this whole process and this paper. So Hala, lastly, but most importantly as well, over to you to introduce yourself.
So my name is Hala Rashidi. I am the Grants and Impact Senior Manager at MQ, and I was the MQ lead on this paper, at least since I joined MQ in February 2022. And before joining MQ, I worked in the humanitarian emergency response sector with Syrian refugees who were forced to flee their homes and settle in Lebanon. And this was a very vulnerable population that was hosted in a very vulnerable environment, which is the case for many refugees. In the context of this over a decade-long Syrian crisis, the mental health and well-being of the Syrian refugee community has been shaped by so many factors, including not only individual vulnerabilities and war-related trauma, but also daily adversities, lack of access to employment, to education, to basic resources, to legal residency, to the poor quality of accommodation, marginalization, and other factors, including community support and family support. And all of these factors are not constant. They're changing across time and they're changing across stages of displacement. And for me, what is unique about the Gone Too Soon is that it captures this very intricate, cumulative, and multifactorial nature of risk that operates across the socioecological levels. And it addresses this risk in a very comprehensive and layered approach. So not only does it recognize that context is important, but also it recognizes that the fragmented approach and fragmented interventions in dealing with this public health crisis will just not cut it. So that's my takeaway, I guess, Emily.
Fantastic. Thank you, Hala. I realise I've been amiss and not introduced myself. I am your chair for this evening, just an anonymous MQ person, but I head up our development team here at MQ, which just essentially means I look after all our different partnerships across the organisation. And I have a particular passion for this area as well in terms of my own lived experience, particularly around self-harm and anxiety. And so it's a real pleasure to see MQ do this amazing work and then be here myself to chair this event. So without further ado, you've had our introductions from our panelists, you've had a little bit of context about the process, the recommendations, but Hala, if I can come to you with our first question, sorry to come back to you straight away, but I wondered if you could tell us a little bit more about actually, well, why did MQ want to take up this quite big challenge in terms of the Gone Too Soon paper?
Other than that's what we usually do. We like big challenges. So like most of our work, I guess, the starting point was asking what research is out there, what is being funded. And MQ identified that there's a gap in addressing premature mortality associated with mental illness and mental distress, primarily from suicide and comorbidities. And we realized that this is a global burden that is preventable. And I guess that was the driving force behind it. We always aspire to bring collaborators together, to break new ground, to bring different perspectives and provide the space for everyone to exchange knowledge. And most importantly, to have lived experience experts included in that conversation and leading that work as well. And so this work, I guess, the Gone Too Soon endeavor was the aim of it was to inform our funding goals and to help us advocate and work with funders and policymakers to move towards that goal and to address this gap that we've identified and to set out prioritized action to address this gap. So in part, expert meeting is something that we've already done before with the COVID-19, as you've mentioned, and we do it really well, and that's a strength. But on this project, I think we took it to another level because we've expanded that collaboration. We've worked also with the William Templeton Foundation for Young People's Mental Health. We've worked with different collaborators, and hopefully we will continue to build on that later on.
Brilliant. Thank you very much, Hala. Again, just really helpful to have that kind of context and the need behind why this whole process started. So Rory, if I can come over to you next, and you've touched on some of these things, but I wondered if there's anything else in terms of what was the biggest surprise kind of out of the findings or the process itself?
I think in terms of surprising about, or maybe not surprise, maybe that's not the correct word, but in terms of the process, it was a remarkably rewarding process. And of course, we didn't agree on everything. And I think that's always a challenge when you're trying to bring together such diverse views. But on the whole, we all, in terms of the three overarching themes that emerged from the solutions, I think that captured, I think, everything. I mean, it really did capture the major solutions that people had suggested, because I can't remember now the numbers offhand. I'll just quickly look. In terms of the number of potentials, initially, so if you think of the scale of the challenge we had, when we had done the pre-work and those early workshops, from the pre-work, from people's suggestions about the number of risk factors, there was, I think, 866 risk factors identified. And then similarly with solutions, there were 522 separate solutions. So the surprise then for me is how we were able to synthesize that into 18 overarching, or 18 separate factors, 18 separate solutions, 12 risk factors and mechanisms, 18 solutions across 3 broad areas. And I think that really illustrated, I think, that consensus. So we did try and operate a consensus process of course, trying to synthesize what, and the other thing is, you can see from the methodology of the process, we had this impact feasibility assessment process, in which, when we were trying to think about the solutions in particular, we wanted to ensure that the solutions had global applicability. And so that in a way was a challenge we had in terms of some of the suggestions which were being put forward, which had high income relevance, high income country relevance, perhaps less so for low and middle income countries. So I think for me, that surprise was trying to bring together all those different voices to be recognize the diverse audience we're trying to address. And for example, when I think about the suicide prevention literature, 3/4 or about 80% of all suicides occur in low and middle income countries. So I wanted to, as a suicide prevention researcher, it was really important for me that whatever we proposed in this consensus give rise and was applicable across that wider global audience. But we did. The short answer is that's what surprised me. Bringing that together, we got that synthesis and consensus, and perhaps that's a reason it took 18 months. Perhaps.
Definitely not a simple process at all, and it's amazing thing, I guess. Yeah, encouraging that challenge, that disagreement, to then allow you to come to some really strong recommendations that make it much more likely that people are going to take these up, because they feel like it's been a process that you've had that consultation, people have had that opportunity to speak about what matters to them and what their thoughts are on this process. That leads me quite nicely, I think, onto my question for you, Harry, in terms of thinking about that and what you would want to see from this paper. You know, what do you hope will be the impact of these recommendations?
Yeah, I mean, there's so many, but it's accessible at so many different levels. So I think for me, looking at the work that I do, but also my personal passion, it gives me space and clear guidance essentially to work towards. So I have that confidence, have that assurity. But from a bigger picture, I hope that there's increased investments. I'd love to see each of these steps broken down. I'm sure that will come in the future to say, well, actually, you know, it's recommendation number 4, this is what we've done as a result. Looking back to it becomes almost something you can benchmark against, and then there are groups that work towards achieving that. For instance, in my work, I took that stat and I noted the one that Rory mentioned, and when I read the report, around 80% being from low and middle income countries. You know, the work that I do is in the 20%. That's honest truth. How do I then help to impact those in the 80% where there is that bigger issue? So for me, I will use this personally to help guide my work, and also where I put my personal passion to the topic. But equally, I think it will give people confidence as to the work that they're doing, actually, because I talk about this stuff quite a lot. It was quite reassuring to see that actually it broken down into key component parts. And I think that will give people that assurance as well. Equally, it's not a case of stopping there, but actually, okay, what can I do to, you know, outside of my current scope, in line with the recommendations? And I look forward to, seeing what impact it's had later down the line. And I hope to personally be a part of that, but also encourage more people to be a part of that. I hope individual people can put pressure on certain groups in society, government, their workplace, to do better in line with the recommendations here. So there's like 3 different levels. There's the government level and above, the individual workplace, school level, but also individuals and where they can put pressure. So hard to really bring that down into a nutshell as to what I hope happens from it, but really less about the report, more than what now happens in the next 5, 10, 15 years and above. So yeah.
Thank you, Harry. And I think, that's really important, starting to think about those different levels of people, organizations that we're wanting to take away these recommendations and do something with it. And what are those different levels at which people can interact with this, which I think particularly we'll talk about towards the end of our set questions, as it were. So Paul, I will come over to you. And as a kind of fellow philanthropic funder in this space, what do you see as the role, particularly of philanthropy and foundations, in advancing our understanding in this particular area and more broadly in mental health?
Spend first. There's a need, there's a huge need, and there's a roadmap alongside it. But I think that the report spoke quite helpfully about sort of 3 buckets, if you like: research, intervention, and policy. It seems to me philanthropy's got interesting role to play in each of those. I mean, in terms of research, there is so much more to understand, and we're coming from a position where, research spend, at least in the UK, is on mental health issues is much better than it ever has been before. MQ, I think, to a considerable extent to thank for that. But nonetheless, it's still lagging behind, and it's on the back of chronic underfunding across a generation and more. So, clearly there is research funding that is critical. There's secondly, and then in terms of interventions, there's a long and noble tradition, I think, of philanthropy being, if you like, the kind of risk capital for government. Where there are high risk, interesting potential interventions, actually philanthropic money being used to fund those interventions and fund some of the research that goes alongside that. And some quite interesting pointers, for example, in terms of digital interventions in the report, and I think quite a rich area really for philanthropy to work with civil society. And then thirdly, policy, which on the face of it might be seen to be squarely in the court of government and statutory authorities. But of course, there's a critical role, I think, for philanthropy to support civil society in its lobbying of governments, not just for policy change, but for increased statutory spend. And by and large, those kinds of groups for that kind of work just need unrestricted funding, and unrestricted funding in a way that cuts across multi-years. So I think there's the roadmap also in a way sets out a roadmap for philanthropic funding for those who are willing to engage. I think the other point, Emily, to come out from it, which is perhaps slightly at attention, but the holistic way of looking at this, that so many funders who are perhaps working in areas of social justice, who are working with refugees, wouldn't necessarily see themselves as mental health funders. But actually, perhaps one outcome from the report will be that more funders who previously may have been interested but have seen themselves as doing something at a tangent will see themselves as being mental health funders alongside whatever else their priority focus is.
I think that's such a helpful point. And actually, I think almost can be put back to your previous point about those three different areas as well. And the fact that the research, the intervention design, the policy side also have to be so interlinked to actually make any of them work. They can't go in isolation. And then just as you're saying, these different areas, I think we're starting to see how mental health does just cut across all these different areas. So funders who might have put themselves in a particular camp, actually, mental health it can't really avoid it in that sense, and actually can have great impact if they start getting involved there.
Emily, can I just jump in on that?
Please do, Rory. Just
on that Paul's point, because I couldn't agree more. But it's one of the other messages, sort of theme that runs throughout the paper is it takes, if we really tackle premature mortality, it will genuinely take a whole of government, a whole of society approach, and so the desiloization of obviously mental health, and if, again throughout the paper, it's challenging inequality, stigma, discrimination, victimization, these large-scale, huge public health issues, and I think that will take. That takes all of the approaches that Paul was touching on. So just to reiterate and reaffirm that.
Thank you, Rory. No, that's a really helpful point. I think just to bring it back to that paper in the sense that that is, as you say, Paul and Rory threw out there, just making sure all of these things are taken into consideration, and you can't really actually separate them from each other. So Harry, if I can come back to you, I think in some ways you answered my other question in terms of what you want guests to kind of take away from this. So I wonder if I might be cheeky and change my question slightly to pick up on the points we've heard before about the importance of lived experience in this. Obviously there's this paper side of things, but there's also the broader fact that MQ wants to make sure that we have people with lived experience involved in all stages of our work. From your perspective, being someone with lived experience and the work that you do, have you got some key messages you think people to take away, maybe more around that and the lived experience side of why you need that involvement and the impact that can have?
Yeah, definitely. Well, I actually had a more thorough answer to give back to the initial point. I realised I half answered.
You can do both.
I say one more thing back to what I should have said, which I missed, which was in the report. For those who haven't read it, it gives an example, at least one example per each recommendation. I found that incredibly useful to then look at, and I haven't obviously had a chance to go through every single example that was cited, but really useful. I learned a lot as to what I could do better, and also, connecting different organizations across the globe. There's an amazing resource for that. I would personally love to learn more about different examples and seeing more of that. Not to put more pressure on you because it's been published, but how else can we learn about each one of those, and having like a suite of different examples that we can use, I think is a definitely exciting thing. Hopefully it can come in the future. So, okay, so going back onto the importance of lived experience. I mean, why I support MQ is that it brings that blend together. The fact that your brand and charity strapline without research, it's just guesswork, is so on point with this particular report, because you're bringing in lived experience, you're bringing in the highly trained professionals and researchers, and you're allowing people with lived experience to actually have a voice, because that's what's hard, is that you want to be able to channel that energy, channel that perhaps injustice, perhaps frustration, or the mix of emotions that might come, perhaps having lost someone to suicide, or like I say, the current lived experience, and actually you're giving people a platform to then give back and use their experience to actually change for future generations. And I personally can't thank you enough for that. So I guess what I want people to get out of that is to keep supporting MQ, make the most of the research that comes out of MQ, and then use that to help guide your own personal professional work. Of course, I only know a handful of backgrounds from looking at names on the attendees today, but trying to support MQ as much as you can and trying to get involved. I'm sure Emily and Bryony and they want to be inundated with how we can use lived experience to better harness and mobilize action, I guess, for the future. From a personal point of view, before it's now a professional occupation of mine doing this work, I channeled all of my energy into the charity space. Every ounce of energy I had, it was my biggest coping mechanism. It was probably my form of therapy. It was my protective factor that I had, was having charities and having associations with people who had some similarity to me, because that was part of the reason after I lost my father to suicide, I didn't have that community of people. And I think that is what you have done a really good job as a charity, is bringing people together, allowing their voice to be heard. So more of that, more research papers that allow people to have access to, like Rory's work and the wider researchers that are involved. It's a very rare opportunity for people. So yeah, numerous reasons. Read the report, read the examples, see how you can then use your own energy in line with that, and keep supporting MQ.
Thank you, Harry, and apologies to spring that one on you slightly in terms of providing that voice in terms of lived experience. So it's really, really appreciated. Okay. Paul, I guess in some ways a similar question to you then. You've touched on this a little bit already, but what would be your call to action to those in the room, and particularly, I guess, those other funders here with us today?
I think thinking holistically was a big takeaway for me. I've heard it said in conferences that we're all environmental funders now, and I think that's true, but I think it could equally then be said we are or should all be mental health funders. It's one of those prisms through which, as funders, perhaps we should be looking at everything that we're doing. My second takeaway, I guess, is that I started off by saying, these are a tractable set of issues. I mean, that's the beauty of the report. But there is still a significant amount of investment that is needed alongside them. Much of that will have to come from statutory sources.
Progress.
But there has to be a philanthropic element in there. And then the third takeaway for me, and I think probably for a lot of funders, is we've talked about silos in many different ways, but there is a tendency for us to define ourselves geographically, to think about things in a narrow sense. And the beauty of this report, I think, was thinking about mental health as an issue that knows no boundaries, in a sense. Think about infectious disease as knowing no boundaries. Actually, it's true of mental health, and whether we're funders or however we're approaching this problem, we probably need to break out of our narrow confines and recognise that, A, these are issues that cut across boundaries, but B, actually the big burden remains in the lesser resourced world.
Thank you, Paul. And I think you've set us up nicely for what will be my last question for now. So also giving the audience a heads up that please get your questions ready. Feel free to start putting some of it in the chat or get ready to raise your virtual hand. And also once we get to that stage, we'll kind of stop the spotlighting of all our panelists so we can see all you wonderful people as well. So my last question is over to Hala to really start thinking about, so where do we go from here? What are the next steps from MQ's side of things?
So from MQ's perspective, we really didn't even wait for the paper to come out. We started before then. So building on the priorities that were identified throughout the road mapping process, we have already funded 7 fellowships that address premature mortality from suicide and physical comorbidities. And these were funded in 2023. And my colleague Helen will put the link there and the chat so you can read about all of these projects. And hopefully we have a few more to come. But the findings and the recommendations from the Gone Too Soon paper will also inform our upcoming funding calls. That will focus not only on treatment, but also on prevention, on public mental health, on social pathways and environmental pathways, on understanding and improving mental health outcomes and care and health systems, while also integrating lived experience expertise throughout. So I think in terms of funding, it will really shape the funding calls that we deliver moving forward. But what we've also learned and what we've started doing but will continue to do is we will work proactively to expand our network and to include more voices, whether it's the range of lived experience expertise or new voices, including researchers from disciplines outside mental health, so economists, anthropology, public health, history, or stakeholders in policy or community organizations. I think to drive change, we need to work collectively and collaboratively across expertise and across disciplines and across methodologies and across geographies. So that's a big lesson learned. And we are not there yet, but we will continue to proactively work towards getting there. So other than that, on something more tangible but policy-oriented, we have recently incorporated the recommendations from the Gone Too Soon in the evidence that we will be submitting in response to the government's new call for evidence for major condition strategy. So that's something else that we've been working on. And I think it is a work in process, so there are more next steps to come, but these are the things that spring to mind at the moment.
Fantastic. Thank you, Hala. And thank you so much to all our panelists for all your contributions so far. So it is now over to you, the audience. We've had a couple of questions come through in the chat. I saw, Nick, you've got your literal hand up. So please, if you can unmute and ask a question, we would love to hear from you.
Emily, thank you. And regretfully, I haven't read the paper yet, but I understand what it includes. My quick point was that there's an economic case for improving mental health, and we hear it from the government every day that there are not enough people going into work. And we know from personal experience that if you have some work or something useful to do every day, it's good for you. And seems to me that the economic case is one we should bang the drum more for, because there's something in it there which is, bigger. It is part of as big as climate change, but we don't talk about the economic aspect. And here's the Metropolitan Police saying that they can't afford to, look after mental health inquiries. Well, that's a problem. Who's going to do it? And I'd like to hear more about the economic case, which sounds very hard-boiled. I know it does, but it seems, as an accountant, I can't help think like that a bit, and I can't see it as being anything other than worth a great deal of investment in. That's my real point.
Thank you very much, Nick, and a very good point. Rory, I think, can I pass over to you for an answer to this one?
Absolutely, Nick. I couldn't agree more. I think we haven't done enough in really making the economic case as strongly as we could or should. But in the suicide prevention field, for example, we are getting better at making that case. And although it's awful to reduce somebody's life to figure a number of pounds in our case, but we do know from the economic analyses conducted in suicide prevention is in Western countries like our own, there's different estimates, but every suicide call on average costs the economy about between 1.5 and 1.7 million. So certainly in Scotland, where I live, we've been making that case for years about trying, if you invest in suicide prevention, not only are you alleviating awful pain, distress, and heartbreak, but economically it makes sense. And as you say, that if you look more broadly at morbidity and workplace issues, absolutely you can make the case even stronger. So we definitely should be doing more of that.
Thank you so much, Rory. Do any of our other panelists want to say anything to that point? Otherwise, we can move on to a couple more questions we've got. If it's all right, I'm going to quickly ask one that was dropped in the chat earlier from Emma. So her question was, what are your opinions on potential public-private partnerships to rapidly scale mental health support, making it easier to get innovation to those who need it? And how can we better collaborate to reduce the time lags between research, implementation and scale? And then also, how can those innovators and lived experience experts from across sectors collaborate more effectively on policy, regulatory and ethical frameworks? So I think it's a question really about that transition from research into kind of practice, both from a policy perspective, but also treatment intervention side of things. So who might want to take it from our panel?
Well, I'm happy to kick off if you want.
Go on, Rory.
Maybe do it back to front. So I think funders need to be braver and taking more riskier decisions in terms of higher risk interventions. For example, I don't mean high risk in terms of causing harm. I mean high risk in terms of funding stuff which may not be effective, but taking risks so that you can get the evidence, the basic science done and implementation and the practice much quicker, and try and fund larger scale work, which really does fund the whole process from discovery science, theory building, testing, through the implementation. And I just don't think we're doing enough of that. And so hopefully the funders will do more of that, but I appreciate it's obviously higher risk. In terms of the innovation stuff, I always think of zinc, and actually Lee might have more views on this than or others on this on the call. Zinc in UK do a great job. Obviously, they're venture capitalists, and they're looking at how venture capitalists can focus on. I spoke to them a few years ago, looking when they focused on, I think it was youth mental health or women's mental health. Both of them, I think, have been priorities. But that's one of their key missions, is trying to get the best innovation, and evidence, but into practice. And I think as quickly as possible. And I think in the mental health sphere, again, I don't think we've done that more quick enough. Lee, do you want to say a bit about that, or others on the call? Paul, maybe? Paul?
Lee, why don't you go first? I'm happy to come in on the risk point, because I have got one or two thoughts on that. But Lee, you go first.
Yeah, happy to. Hi, everyone. My name's Lee Milligan. I'm the CEO of M2 Mental Health Research. So Rory's referring to Zinc, who are a venture capitalist firm who have set up a discovery platform to invest into founders who want to start up new companies around a particular social problem. And last year, mental health was one of their key topics. I was a visiting fellow on the project. And I think innovations like that have been really interesting to see how venture capital money can try to solve social challenges, but still make them sustainable and financially viable. When you speak to senior leaders, for example, in the NHS, or you speak to regulators at the FDA in the US, they say the same thing. There is no way that the current infrastructure is going to be able to deliver these wonderful new interventions that research keeps promising. We mentioned digital therapies a minute ago as a potential part of the solution, and we're looking at low and middle income scalability. Digital seems to be the buzzword we'll land on. But again, what's the infrastructure through which those new interventions can be delivered? And if we don't bring the private sector on the journey with us and make sure there's a sustainability element to that, I'm not sure we're actually going to get some of these novel interventions into the hands of people. Now, that comes with huge challenges in its own right. We already are talking about a society that doesn't trust big social, it doesn't trust big pharma, it doesn't trust big food, and yet we're saying, how do we bring industry along with us on the journey? We also know, I can see Anne John and people in the room, we know that research tells us that people see their mental health data as more sensitive than any other data they can give, their mental health records more important than any other health record they've got. And so we are at risk, I think, on in trying to protect patients on one side, on trying to make sure we're solely evidence-based on research on this side, that if we don't bring industry on the journey, all of the great work and research we're doing isn't going to be sustained into action. And this high risk investment that both Rory and Paul alluded to, philanthropists taking risks, it then needs backed up by industry running it sustainably. And therefore, government's not going to solve all these problems. So Zinc, I think, is a great model. I think there's some other great companies out there doing similar things, but I think we've got to be braver on the types of models we're willing to work with, but also make sure that we bring people, the public and industry together hand in hand to try and solve some of that. Otherwise, we'll end up exactly where Big Pharma has ended up, untrusted, looking like we're there to make profit, et cetera, et cetera. Those are 3 reflections. Paul.
Thanks, Lee. Yeah, my point is relatively straight. I mean, I think in my one of my earlier answers, I said that philanthropy has a noble tradition of being the kind of risk capital arm of society. I think I was probably being a bit kind to philanthropy, to be honest. I mean, I think there are noble examples of that. But I think one takeaway from the report is that there is probably a need for philanthropy to be a little bit bolder in some of the kind of very early trials, early interventions, very high risk. As Rory said, I mean, not high risk in terms of patient safety, but high risk in terms of potential for failure, and for philanthropy to be willing to accept failure as the price for change. So my point was really about the kind of very early stage of thinking about that.
Fantastic, thank you. I don't know whether, Harry, you have anything to add, particularly from from all your different aspects in terms of lived experience of around this question of how we make sure we speed up that process from research into actual intervention.
Yeah, not particularly. I don't have a huge amount to add. I mean, I'm also familiar with the Zinc program, wanted to apply to the Zinc program, a few things got in the way. So I endorse that. I think that is a really powerful gateway into. I wish there were more schemes that perhaps were a bit more accessible. So you get a wide range of different businesses to that point, and again, making them financially sound at the same time. But no, I think, MQ is the route in from what I see looking in. But equally, like I say, yeah, exploring zinc. But I also noticed there's a question around a different form of zinc in the chat, which I was also trying to come up with some answer for, given a food and drink background. But no, I think it's about having more of those particular programs like zinc. I was incredibly tempted at that point because I love that fuse between having expert professional backing and support, but at the same time being set up as a business. I think those charities and those movements that are set up like businesses are ones that can therefore go back and provide more services when there's more income coming in. So, I mean, no, not a huge amount to add.
Thank you so much, Harry. And I'm going to be really cheeky because Lee mentioned that we've got Anne John in the room. So, Anne, I think you said you've got something you might be able to add just particularly to this particular point.
So I guess just partly to pick up on what Lee said. So I think there are issues around trust in terms of partnering with industry that we have to actively work on in building bridges between industry and the public and people with lived experience. And I guess the other thing, so within the paper, there was that whole section on we need to focus on prevention while strengthening treatment. And I think sometimes with industry, because there can be a focus on quick returns, prevention can fall by the wayside. And so I think there's work there to show that even when the outcomes can sometimes not be counted very well, or sometimes be decades in the future, that we need to change that mindset of quick returns.
Thank you so much, Anne. I've just put a link to who Anne is in the chat as well, should you wonder. She's a wonderful one of our newest board members and a fantastic professor, particularly around mental health data science. So I'm going to move on. So Sarah, you've kindly been waiting with your hand up, so I would love to pass over to you for your question and comments.
Thank you, and apologies for those of you who saw me earlier grabbing the cat. Yeah, I think a few things, but I'll try and keep it brief. I was very proud to be part of the paper development. Thank you for the opportunity. And I think I was interested to know if there's an implementation group. So for the Lancet Commission on Ending Stigma and Discrimination in Mental Health, I helped Graham and Charlene create an implementation group. We meet monthly to actually get the recommendations we've recommended delivered. So it'd be good to know if such a group will exist. Having been at the World Health Assembly last week and at a number of events on mental health and what's happening around the world, I made a big plug for pesticide regulation. So Rory, very much thought of you. We also talked, there was a session around innovation, and I think it's really important to say that mental health innovation as a concept is received very differently in different environments. So high income countries see it as apps and things that you can opt into, or perhaps your health insurer, or even in the UK, your health system might pay for. Low middle income countries are a lot more skeptical. They've had bad experiences of pharma and private development. And in fact, on the panel, one of the panels, the only gentleman actually who represented low middle income countries said that it was unethical to make money on the backs of the most vulnerable in society. So we have quite a long way to go in the language of innovation and how it's expressed and understood. And the only other thing I was going to say was I think it's really important to look at the drugs and treatments we do have and their side effects and what that means for people, not just now, but in the future. So there's a lot of conversations at WHA about the impacts of climate and environmental change, which is already a big factor for health in countries, particularly in Africa and the small island developing states. And one thing that was discussed is thermoregulation, so the body's ability to regulate temperature and how much that impacts mental health, particularly if you're taking psychosis drugs which affect psychosis. So a few issues to think about. I think this report is very timely, and I'd like to be part of something that gets the implementations of the recommendations we all made. Thank you.
Thank you so much, Sarah. I wonder if Hala, I might be able to come to you to kind of comment on some of the points that Sarah's made there, and then also that broader piece, again, even linking back to the last one in terms of around that innovation side.
So we do not have an implementation group in place now, really gone too soon. We might have, to be honest, it is really related to funding as well. And we did touch upon this point before, but one of the funding that we need is that's funding for collaboration and funding for implementation and funding for networking, really. So to bring these groups together, which is something that we've mentioned before, to have these discussions, to offer this space, we need funding for that. And one thing we've noticed is that funders prefer, they want to see that result. They want to see it directly. And to invest in these kind of collaboration, we always have to make the case for it. So part of that risk funding, which we're not saying it's a risky process, but we need to invest in collaborations. We need to invest in the next step. And so far we don't have the funding for that. We don't have the implementation group in place, although we are working within the capacity we have to build researchers' capacity so that they can carry out their research projects and look at their pathways to impact and how their projects can be carried on and through to the next stage. And we're trying to link them and ensure that they have the networks and the connections to make that happen. But it's all within the capacity that we have at the moment. So not beyond that, unfortunately.
Thanks so much, Hala. I don't know if any of our other panelists want to speak to any of the points that that Sarah made there as well.
Well, just the only one I'd make is the point just on trying to get the implementation of the practice for the solutions. I think, so Sarah gave an example, obviously, of how she used one of the recommendations to, very clearly in terms of the pesticides. But I think, certainly in my role in terms of the presidency of the International Association of Suicide Prevention, I'm bringing the recommendations there as well. So I think we can all look at organizations where we do have influence or some sort of lobbying role to try and ensure that the recommendations are implemented. But perhaps I just see Peter Jones is on the call as well. He's the chair of our MQ Science Council. I just wonder, Peter, maybe we as the Science Council have a role to think about this. Peter, do you want to comment on that? We're trying to monitor or see how we can better implement the recommendations.
Yeah, well, it's a really important point that's been raised. I mean, implementation and impact is something that, as you know, we're wrestling with as a charity and in the Science Council, but I think it's a real gap. It would be a shame if such a fantastic piece of work doesn't actually have a mechanism for implementation and impact. And I think we do have a responsibility to lead and coordinate. I mean, I've been very interested listening to the conversation. I'll just make a quick comment because I know Sophie and Alex are waiting, but when you were talking, Paul, about the funding landscape and the responsibilities of funders, you know, where are charities like the British Heart Foundation in this conversation? It seems to me that if you suffer cardiovascular disease and the potential of death, and you don't have mental illness, you have one of the biggest medical research charities in the country behind you. If you have cardiovascular disease and you have mental health problems, then, well, they're not at the table here, are they? So, you know, we've got some powerful beasts that we are still to make links with, and I think we should be swinging them in behind implementation as well as research. I'll leave it there because people are waiting. There's a lot to think about, isn't there?
Thank you so much, Peter. It's a really, really good point in terms of think about who those other networks are, other charities, even in this space that we need to make sure are part of this conversation, particularly as it crosses over with that kind of physical health side of things. Sophie, I will come to you again. Thank you for patiently waiting with your hand up. It would be great to hear what your question is.
Hi everyone, so I'm Sophie Brigden, I'm an MQ ambassador and I've had my own lived experience with PTSD. So I'm really interested in what all of this research, and I guess my question is, at what age are these sort of interventions going to start? Because when I think about, you know, interventions and even people wanting to step towards gaining help, there's that stigma there, there's that fear around emotions underlying so much of it. And many of the problems that we're facing with mental health is because we've had this conditioning, we've got generational stigma, and underlying it is, you know, this kind of lack of understanding of emotion, of how to deal with our own, but other people understanding how to deal with people wrestling with these difficulties with emotions. And I think personally, for me, that's part of the reason why I withdrew. And I felt so suicidal, you know, at points going through what I was going through. And in terms of those interventions, I just would like to be, or I'm quite interested in, at what age are you going to go in and start sort of opening up these discussions and making it easier for people to want to step towards, because we're talking about adults, aren't we, in organisations a lot. But what about earlier?
Thank you so much, Sophie. Firstly, also for sharing your own experience as well, and for that really, really helpful question. Harry, I wonder if I could go to you first and then over to you, Rory, from the paper side of things. But yeah, Harry, it'd be great to hear your thoughts on that question.
Yeah, I guess thank you, Sophie, for sharing. I mean, lots of what you shared, as aspects I can relate to, both from the work that I do, but also from a personal capacity. So my very, very short answer to that is minus 9 months years old, actually. So I recently became a father, and that is one of the reasons why I haven't been able to go through every single example of the report just yet. And I found myself at every single stage of that journey, my partner becoming pregnant, learning more about what the efforts that I need to then go through to then be able to be a parent to the best of my ability, how I'm going to then have conversations around emotions with my child. And it showed me at every single stage that, again, there is nothing to be done to better equip parents on how to have those conversations. So my point around saying that is that it should start at the earliest age we can. Like, as I see those practical steps here, yes, I agree with every single aspect of that. I looked at that and think, okay, well, what is the role that I can play when it comes to increasing access to that education around equipping people to have conversations with emotions, spot the signs, reduce the stigma. So the school system, of course, needs to do more, not only from a prevention perspective, but also equipping teachers, students, and parents to have very informed conversations around mental health and well-being. And I remember I was invited to a school open day by the charity Place to Be, which I'm sure many of you know. And I sat there as an open day as someone in the mental health space to hear about the role that they play in creating environments where parents, teachers, and students can talk about their emotions. And I sat there and I listened to a parent, a teacher, and a student talk about the role of having trained counsellors and experts in the school system that they could refer to every single day. And they were able to have conversations openly from the age that this young child was probably about 6 or 7 years old. And then different parents came in and said, if I don't know what to do, I don't know how to talk to my children about this, they could speak to an expert in school. I had a look then at how many schools have access to that in school, and it's barely any. Like, it is barely any. Going back to the report and the comments that Rory made around 80% from lower middle-aged countries, if we break that down again and look at the 20%, I would imagine, making up from an outsider's perspective, that it would be lower middle-income households in the UK, in the US, etc. So how can we create environments in our school systems where people spend most of their time to give people the skills to break down the stigma by giving them conversational skills, how to spot the signs early and how to have informed conversations? The role that and I'm sure there was a bill in Parliament at the moment around increasing access to suicide education in schools. We spend most of our time in schools, then we spend most of our time in work. People are spending 40, 50 hours a week in work on average, and we have to give people the confidence to spot the signs and equip people in the moment, because exactly like, the gentleman's gone off my screen now, mentioned around the Metropolitan Police, sorry, I've lost the person's name, Metropolitan Police recent announcement. Well, who is going to pick that up? When I look about how I can use my 5 days a week to give back, it's around giving people confidence and skills in the moment. And I would say about 5 of the recommendations were in line with that. I wish, that I could play a role in some of the recommendations, such as where I had on my screen just now, policies to restrict access to lethal means and discriminations and decriminalisation of suicide. It's an area that I read about a lot. I cannot play an impact there. However, I know I can play an impact when it comes to increasing conversations around emotions. Anyway, I'm going on a bit of a tangent, but hopefully the 90% before I got to that point was worthwhile. So yeah, minus 9 months, if you answer.
Wonderful, and thank you, Harry. It's wonderful to have you here anyway, even so early days of your new baby has arrived, and to now see that kind of experience from that side of things of being a parent as well. Rory, could I hand over to you for your kind of answers to that question?
Yeah, no, Sophie, good, and I agree with everything Horace just said about the education stuff. But absolutely, in the paper we highlight in one of our solutions, we really target infant development and pre-infant development, because we know the impact very early on, both in brain development as well as broader cognitive and social development. And so yes, absolutely, we deliberately took a lifespan approach. So and when you think about that preventative element, and the early intervention work we touch on in the paper really is thinking as soon as you're born type thing, and pre, as Harry said, obviously the gestational period is also important to bear in mind as well. So yeah, really important. So I agree entirely.
Fantastic, thank you, Rory. Apologies, Alex, we're going to quickly go to Heather, who has asked a question in the chat. But Heather, I don't know if you want to unmute and ask it, or I can read it out for you. Up to you.
Hi, yeah, I'm happy to say it. And I'm sorry, I've misunderstood because I haven't been able to read the paper. But I just was wondering, you mentioned zinc. Were you able to look at, and do you think we should all be looking at a whole bigger range of micronutrients into people's diets? When people are coming into the mental health system, should practitioners not be reviewing what they're eating and getting dietary advice before they reach for the prescription pad? Should we not be doing a whole lot more with food and people's diets?
Thank you so much, Heather. Rory, I don't know if I can come back to you straight away with that one.
Yeah, very quickly, yes, it's a short answer. We've highlighted the really promising research looking at the role, for example, of the microbiome in mental health. And so, yeah, it's an area of growth and really important area we need to really look at. And it obviously speaks to the point that when we're looking at mental health, there's no health without mental and physical health. So, of course, looking at diet, and again, that's embedded within the paper. So, yeah, I agree.
Thank you, Rory. Paul, I wonder if you have anything to add here in terms of, obviously, you fund research across the board in terms of, it's obviously not just mental health. If there's anything there that you funded at Wolfson or that you've seen coming through in terms of applications.
No, I mean, only that, you know, back to the point on silos and, the question really, and Rory's answer is partly about breaking down, you know, old-fashioned, neat labels that sit on things. And so, I think we are increasingly seeing in research proposals a mental health perspective on a lot of the projects that we're involved in funding, the question on diet really ties into that.
Thank you, Paul. And I wonder if I can be sneaky before we quickly go over to Alex, but also just on the previous question as well, Sophie's question around age. And I know obviously Wolfson, in many of your first and kind of biggest investments, you have focused around young people. Are you able to talk a bit about why that focus? And again, if you have an answer to that age side of things.
Great. I'm not going to argue for starting interventions at 25, after. No, I mean, I completely endorse what Rory and Harry have said, and taking a kind of life course approach to this is surely the right way to think about things. You're right, we're a funder of education as well as research, so we've had quite an interest in formal education settings. I mean, I think Harry is absolutely right that from what I've seen of interventions in formal education settings, there's some really brilliant practice and some strong evidence base alongside it. The challenge is rolling that out into a kind of wider group of settings, really. So, I know Place to Be working on it. I know the Wolfson Centre down in Wales, and John is very much involved in that. It's thinking about things across, a large group of schools, in the latter example, across all the schools in Wales, and how you can get rapid interventions into schools at a relatively low cost base. But I think one of the challenges within the education environment, what I'm talking about here is the UK, but I'm sure this is true internationally as well, is just how much pressure there is on educational establishments at the moment, and not just financial pressure, but every type of pressure. And the challenge of that, of course, is that it squeezes out time and energy for mental health interventions. Having said that, in terms of early intervention, educational institutional framework is only one of the possibilities. So a few, I fear, slightly rambling thoughts on that, Emily.
You're on mute, Emily.
Sorry, I'm on mute. I was just about to say, Harry, I've seen you've come off mute. So if you wanted to add something there, and then I do want to make sure we move over quickly to Alex for his question.
Yeah, I'll be really brief. And I think just to reiterate the reason why I cited the Place to Be example, and coming back to what Paul mentioned, is that I lost my father to suicide when I was in the early stages of secondary school education, and hand on heart truth, nobody ever approached me on the topic, ever. I was very, very lucky that I was intercepted by a chance encounter by another amazing charity. There's a couple of people on the call, I think, from CALM, the Campaign Against Living Miserably. That was at the age when I was in my early 20s that I first started and had a conversation around suicide loss. From everything that I've learned around suicide, much come from Rory's research and book. I was at high risk. I lost one of the key figures in my life when it comes to suicide. I should have been seen as someone who should have a conversation and learn how to engage on everything that Sophie mentioned around my emotions, the way I've handled the loss, and how I think and associate myself with the word suicide. What it came was I felt quite trapped, actually, by the fact that I couldn't escape this title of my name and suicide. Got to the point that even in myself, when I got myself to a really good job and I was able to do anything I wanted in my life, that was when I had thoughts of suicide. I had nothing through my school system, college, and even into university life did I actually have a conversation, hear anyone's story of suicide loss. Therefore, at that point, that was when I was at my worst. on paper I had a lot, but I couldn't connect all my emotions at all. I couldn't have a conversation about it. So when I witnessed that from place to be, the thought I had was exactly like Paul, was how does that become every school? You know, so teachers can have those informed conversations, parents can, and students can learn how to engage on their emotions. You know, Lee and I met at a film that was called The Sun, and one of the lines in this film was that love isn't always enough, and it was a journey of a young boy who dies by suicide, and his mum and dad show a high level of care and love, but they didn't know how to engage with their son around the topic of suicide, and he sadly died by suicide. So this idea of like love isn't always enough and care and compassion isn't always enough, it's true. You need guidance, you need infrastructure and clear, you know, recommendations as to how people should be using their time and energy. So yeah, just to kind of build on that, now I have time to think about why I cited that as a reason. But yeah, hey, yeah.
No, thank you, Harry. And sadly, an all too common story in the sense of that intervention and that support coming far too late in someone's journey. So Alex, over to you for, I think, what will be our last question of this evening. So please ask away.
So, hi, that's great, MQ. Thanks for hosting it. Really interesting to hear everyone. I actually put my hand up when we were talking about kind of commercial funding of research and development. So the three largest funders of health research in the UK are UKRI, NIHR, and HMRC, because HMRC gives tax credits to companies investing in R&D. It's a fixed rate, it's 12.5%. And in the 90s, they upped it for people doing HIV and AIDS research in order to attract more investment in the area. So if you could imagine, they could have put it up to 20% for mental health, and you've got some digital health charity that's looking at diabetes or mental health or whatever, and they're looking at, well, if I put £1 million in, I'll get £200,000 if it's mental health, and I'll get £125,000 if it's another health condition. And the best thing about this is that the government doesn't have a budget on R&D on these tax credits. It wants to spend R&D into the economy because it thinks it's good for GDP. So they couldn't care less if it's 12.5%. Well, I mean, they might do a bit, 12.5% or 20%. But they wouldn't look at it as a cost anyway. Whereas if you go and ask NIHR for money, they might do. So that was like, for anyone, if you get in touch, I could explain it. It's been done before. You know, you just need the chancellor to go yes. It'd be too hard for me. It's not going to come off the budget. It's not extra money. And then I had a question that there's no mention of medication and the side effects of medication. Just while we were on, I don't know whether these facts are true. 38% of people on SSRIs have side effects, none, weight gain, sex drive goes down. 70% of people on atypical antipsychotics. And I think, I mean, I'm just surprised. I mean, you know, I'm into sort of like psychosocial interventions, but, you know, I think if someone could provide a pill that didn't have those side effects, that would have quite a huge difference on people's lives. That's it. Thanks very much. Have a good evening.
Thank you, Alex. No, that's really helpful. And I think actually a really good place to kind of bring all of this together towards the end of this. But Rory, I wondered if you could comment on kind of Alex's first comments, particularly on that last piece as well around medication.
No, I never. The HMRC thing, I didn't know that. That's a great idea. If we can harness that for mental health, that's fantastic. So maybe Lee can comment on that. On your second bit, so Alex, I think the side effects issue is an important issue. It is actually mentioned in the paper. So we identify side effects as an issue, side effects to treatment as an issue, as one of our risk factors for mortality. And no, we don't mention specifically the weight gain and the other specific side effects you do mention, but we do highlight the importance of more innovation in treatments with fewer side effects. So we're thinking more of the iatrogenic harms associated with suicide risk, but of course, it's more broadly, it's in there as well, but more implicitly, I suppose, is these wider side effects as well. So it's a really important point. So yeah, but it's there.
Lee, did you want to comment on that as well?
Yeah, so Alex, thanks so much for your point on tax breaks. I was at the Funders Forum meeting a few weeks ago. I think you were there and you threw it out. I've got a note right here on my Word notebook to follow up and email you about that, because with 12 months to go to the UK election, if anyone's counting, I think you've got a policy line that somebody's going to put a manifesto in there somewhere. So I think we'll follow up on that for sure. And on the pharmacological piece, we sit on the psychiatry consortium, with the group that has been initially funded by Wellcome and set up to bring together some of the largest pharma companies in the world to try and tackle some of these challenges that you're describing around reducing side effects. And the main headline is, if we can reduce side effects and increase people's ability to use those drugs, then we get better results. The problem, it seems, at the minute is that pharma companies are not interested in new target validation for the very early phase study stuff to understand what the new compound should be, because if they can't get that bit right, then all the investment the whole way through is wasted because they can't get a compound at the end. So what this consortium is trying to do is to bring them all together to pool their money to de-risk the process for them, to try and then encourage them to then advance and move that forward. That project's been about 3 years in the making, and it's just about to launch its second wave of work on that. So there is some small investment going into that space that I'm really involved in and aware of. So your passion is right dead on in the paper, as I say, as Rory says, does touch on it, but I think we're still a long step away from that, and there are plenty of companies that are not part of that consortium yet that we want part of it to try and move it forward. So I think you're definitely barking up the right tree. We've just got to convince some people that their money is worth putting into that space to try and move it forward. And we've taken the position as MQ that it's not our job to be the R&D arm of J&J, etc. But we definitely want to encourage them to get involved and to move that forward.
Yeah, I mean, it's part of the same thing then, isn't it? You can offer them the tax credits that are better.
Yeah. For sure.
Thank you, Lee, and thank you, Alex, again. So we've only got a few minutes left, so it is up to me to kind of round off this evening. Firstly, with an absolutely huge thank you, particularly to our panelists for some fantastic information here, fantastic views on many of the questions that we've had today. Secondly, to all of those involved in putting together this paper. As you've heard, it was a huge amount of work, but a really, really impactful and really exciting one. And also, obviously, a huge thank you to all of you for coming along, for your fantastic questions and real engagement in this subject. And there will be more to come, and I'll come back to that in a second. Just to summarize, I think some of the things that we've heard today, I think starting from the very beginning, what we were talking about particularly was around perhaps the surprising element that we started this process thinking we had these two very distinct kind of areas. And actually, we found that combining both those areas around early mortality really meant that we think we can have greater impact and get that message out there much more strongly in terms of the recommendations and seeing them, as we've then talked about, taken through to actually being delivered. It was great to hear some feedback as well in terms of the clarity of the report, seeing that mix with the examples in there that hopefully means for anyone reading this, layman, researcher, policymaker, whatever you might be, actually it's a really accessible paper to be able to take away. And again, hopefully moving toward then these things being taken up. Particularly again, and I think that speaks to how this paper has ended up how it is that involvement of lived experience from the real beginning of this process and throughout even to today and to today's event. And hopefully it provides a bit of a model for others doing processes like this, but also just more broadly in terms of any of this work, research or policy or intervention wise, that is so important to make sure is a real element of any of the work we're doing in mental health. And then it's thinking about, I guess, where we go with these recommendations. So these recommendations have a real global relevance, but we also need to think about the impact of these from a government perspective, from workplace, and then on the individual level. We need to think about how we're de-siloing the kind of mental health and think about that both from an academic standpoint, from the fact we're looking at suicidal comorbidity, but also geographically. And then from a funding perspective, we need to think about that holistically as well, and the fact that mental health needs to cross across all the different areas that funders might be looking at. That's then true. And interestingly, to hear a number of people saying, there's this need for investment, but actually perhaps philanthropy can be that kind of mover to take those risks and start at those early stages and accept the fact that some of these things won't work, but that's why we need to do it and try and find those new things that will. Linked to that is the fact that these issues are retractable, but we do just need a lot more investment to be able to actually move us along that process. And through the implementation, there's a lot more that we can do as MQ through the people involved in the authorship, for all of you today, to think about those networks that you perhaps already have to make sure that those recommendations are getting through to them. And then finally, just to finish, I think as well, which is a fantastic point about, how early do we start with all of this in terms of age? And it's essentially as early as possible, but how do we make sure, therefore, that we've got those recommendations to think about how we implement those in schools and kind of bring those recommendations, those interventions to where people are at as well. So those are just some of my kind of key things. I've been trying to take notes as we go along and listening to all of this fascinating points from our panel and from yourselves. So just a few last pieces. If you've not had enough of listening about Gone Too Soon, we've got a couple of other things that you can look out for. So both there's a wonderful podcast from Rory, well, two actually. We've got one with the Lancet Psychiatry that Rory appeared on, and then our own podcast, MQ Open Mind, which Rory chairs. And the next one to come out will be focusing on Gone Too Soon. So please do tune into those if you want to kind of dig deeper into this. As Hala has mentioned in particular, we've already made investments into this space, so please go have a read of our fellows, the newest research that's just been launching this year, but there'll be more to come in that space, particularly around the policy side, as Hala mentioned. And then there's some also, just as a heads up, some more kind of policy, more kind of calls will be coming out in the next kind of couple of weeks even, around building on our success around our fellowships, a new scholarships program for those even earlier career researchers, those kind of either last year or kind of 2 years out of postdoc, to really make sure we're capturing those best people and keeping them in mental health research. And another one to look out for, which is all around kind of transdisciplinary research as well, to make sure we're thinking about, again, perhaps picking up on Peter's point in particular, getting those people in from different disciplines to think about how they might apply that to mental health and keep kind of breaking down those silos. And finally, I know obviously we haven't been able to do this in person, so we haven't been able to cheers and toast to the success of this and just welcome you and actually meet lots of you face to face. So we're very early save the date. As I mentioned, we are celebrating our 10th anniversary this year. So we're hoping to have some 10th anniversary drinks later in the year. So that will be on Tuesday, the 3rd of October at the Royal College of Physicians, where we were supposed to be in person today. So please save that date, more details to come. And it would be lovely to see many of you in person and meet you. And as I say, raise a toast together for all of this work, but also everything else that's been going on in the last 10 years at MQ. So we are 1 minute over. Oh, I thought I was on time. So thank you so much for all of you for coming along again, to our panelists and all the authors involved. So thank you. And that is it for tonight. We'll be sending around this recording should you want to watch back. But otherwise, please look out for more announcements coming out. Thank you, everyone.